Now, from News 3, this is Town Hall, your voice, your future, Operation Vaccination.
Strong opinions from locals and tourists when it comes to the COVID-19 vaccine. Good evening and thank you for joining us for this special Town Hall Operation Vaccination. I'm Marie Mortera. For the next 30 minutes, we're bringing in local health and legal professionals to answer your questions about the vaccine and to clear up misinformation. From the Southern Nevada Health District to local hospitals and a law office, these are the experts in our community who are here to give you the latest information about the vaccine's safety and potential legal effects of a vaccine mandate. News 3 crews went to the streets to find out where your concerns and questions lie. Changing public health guidelines, vaccine safety, even teen vaccine hesitancy, to legal consequences of a vaccine mandate in our state. We heard your questions and we're getting them answered tonight. Our first panelists this evening are Dr. Fermin Le Guin with the Southern Nevada Health District and David Perez with Immunize Nevada. Thank you both for joining us.
Of course, thank you for having us.
So let's start with this new milestone in the COVID fight. After extensive research, Pfizer shots have been fully approved for those 16 and older. Will that change the approach to immunizing Nevada?
I'll go ahead and start first. I think that that is great news to hear, and we have heard that some community members were waiting before they got vaccinated to hear this news, and now that it has been announced, we expect that they'll be making their way to their local community clinic or pharmacy to get vaccinated.
Dr. Le Guin, did you want to add to that?
Sure, thank you. Yes, we think that, this also helps with credibility for the vaccines. Now that the vaccines is fully approved, it means that, at least that segment of the population that have been waiting for the vaccine to be fully approved, now they have a good reason to go and ask for the vaccine because now that full approval is already there. Also, it helps, in every sense because now by being full approved, this vaccine is at the same level as any other vaccine that is already in the immunization schedule across the country. So even so, the vaccine is not in the immunization schedule, is at the same level in terms of approval.
Crucial to point that out. Speaking about another population waiting to hear more about the vaccine, children. Here's a viewer question about that.
When are they going to authorize the vaccine for the little kids?
Doctor, did you want to start off with that? When will they authorize the vaccine for those 12 and younger?
Well, we know that the FDA is waiting for the results of the studies that Pfizer and Moderna and other companies are doing on children under 12 years old. So once they have the results of those clinical trials, they will make the decision. The decision is based first on safety of the vaccine. That's one of the most important thing about any vaccine, and of course how effective the vaccine is in protecting the soldiers, in this case children under 12 years old.
If vaccines are available then for this new population, and then we have people getting the recommended boosters, we also received a question about supply.
Will the vaccine be available for everyone in a timely manner if it becomes a mandate?
David, did you want to touch on that? Will there be an abundance of supply?
I can't speak to the abundance of supply, but I can speak to the partnerships that have been created between community partner orgs such as Immunize Nevada with those that have really high level planning such as SNHD, the Southern Nevada Health District. So I can't speak specifically to the supply, but I know that the partnerships will be established to ensure that we're providing those vaccines to those who need them, whether they be a third dose, a booster, or for that new age bracket.
We got another viewer question about vaccination proof.
Why aren't we requiring people to show their vaccination cards or reasons why they're not being vaccinated? Like, again, if you're immunocompromised or you are allergic, like, why don't we have a paper system of sorts?
Doctor, did you want to address that?
Well, sure. Well, I first have to make the disclaimer that the requirement for vaccination or vaccine mandates is actually something that is very specific for certain employers or companies, agencies that are offering services to the community. So is one of those agencies or organizations. They have their own way to request that information. That's not something that us, the Southern Nevada Health District, are asking people to show to us. So excuse me.
And before we let you go, we have about 30 seconds here. Are there any other outstanding questions that you hear of more than others?
That is a really good question. I think just at the moment we've been getting a lot of questions about boosters and third dose and what that looks like, and just letting people know that we still don't have that ACIP information yet. So those that are showing up to community clinics, we know that more information is waiting to be released on that, either third dose or booster.
And from the Southern Nevada Health District's point of view, any other questions that you guys always get there at the department?
Well, in recent days, we have received a lot of questions about the vaccination card and how to obtain a replacement of that card or that information. So it's something that we have been answering to the public. There is everybody have access to their vaccination information at the WebIC site. That is the vaccination site of the state, and also those who need a copy of their vaccination card, they can go to any of our clinics, the Southern Nevada Health District, and we will provide a replacement card for them.
David Perez with Immunize Nevada and Dr. Furman LeGuin with Southern Nevada Health District. Thank you so much for your time, and please stay well. If you are looking to make a vaccination appointment, head over to covid.southernnevadadistrict.org/vaccine/distribution. Right now, there are more than 1,200 people in the hospital because of COVID in Nevada. Most of those are here in Clark County. According to the Southern Nevada Health District, more than 19,000 people have been hospitalized from COVID since the pandemic began. Our next guest is Dr. Dominic Martinello, Chief Medical Officer with Southern Hills Hospital and Medical Center. Doctor, thank you so much for joining us.
Oh, thanks for having me out today.
So let's start off with these questions. People are still in and out of the hospital because of coronavirus, mostly those who are unvaccinated. What do you see are the biggest concerns with people hesitant about getting the shots?
So the biggest hesitation people have with getting the vaccine right now, I think, is a lot of misinformation. So unfortunately, this vaccine came out in an era where information is readily available, but not all of it is high quality. So there's a lot of people who are still afraid of things that are simply not going to happen to them, or things that are extremely low risk. So powered by this misinformation campaign that exists on the internet, there's still a significant hesitancy.
All right, let's go to a viewer question here, and it has something to do with how many vaccines they can get. Let's roll the question.
Can I get 2 vaccines? Because I have a vaccine that I'm not happy with, and I really wanted to get the Pfizer, but it was not my turn to get the Pfizer. So I want to get the Pfizer if it's available in my country.
Sure. So the question around whether we can get a second vaccination series, this has not been studied yet, unfortunately. Both of the 2-shot vaccines and the single-dose J&J vaccine seem to have excellent efficacy right now, so the need to get a different vaccine may not be there. Now, we are seeing booster shots being rolled out as well, so there may be an opportunity to ensure that your immunity is nice and high. But as far as getting a second vaccine series, it's unclear what that would do yet, and I think that over time we'll probably have more science, but for the time being, you would be doing that sort of outside of what science knows right now.
And what we do know about the science that we have here today is now the recommendation about this COVID booster shot. And you brought that up, doctor. So let's talk about that. How will that booster shot affect a vaccinated person's chance of infection or even severe illness?
Sure. So what we know is that the immunity from the first vaccine series is fairly long lasting, but after a period of time, which they're estimating somewhere around 5 months, it starts to wane down. The way that we prevent severe symptoms, death, disability from this disease is really based on how many neutralizing antibodies you have. This booster shot will increase those significantly, both in patients who responded well and patients who maybe under-responded initially. So this will provide us a significant and longer lasting degree of protection against the disease.
And we should keep in mind when these recommendations come out, we are talking about the general population when it comes to the booster shots later in the year. Let's talk about specific groups here, and we want to bring in a viewer question. It has something to do with reproductive issues.
With the vaccine, have we examined any reproductive repercussions?
A wonderful question, because obviously reproductive health is a major consideration. Now, in the initial trials, there was no evidence whatsoever of any reproductive harm. And the American College of Obstetrics and Gynecology released a statement, I believe back in June or July, which said they recommended it not only to women of childbearing age, but also to pregnant and breastfeeding women. And the American College of Obstetrics and Gynecology typically is very conservative in terms of the recommendations they make, meaning they're not just going to tell people to do something that could put themselves or their babies at harm. So this was a wonderful review of the literature that caused them to come out and say pregnant women, women of childbearing age, breastfeeding women, all acceptable to get the vaccine series.
And so your final message to our viewers at home, Doctor?
That first and foremost, I mean, there's great science behind these vaccines. They have an excellent track record so far with, so many vaccines already given out that we know that it's highly effective, extraordinarily low risk, and by and large, it is much safer than subjecting yourself to a coronavirus infection, which could be devastating.
Doctor, thank you so much for joining us here, and please stay well and take care.
And you as well. Stay safe out there, everyone.
Thank you. And News 3 wants to hear from you at home. We asked you this on social media. If you are unvaccinated, has the FDA's approval of the Pfizer vaccine changed your mind about getting the shot? You can weigh in now on the News 3 LV Twitter page. Still ahead on this News 3 Town Hall, Operation Vaccination. COVID in schools continues to be a concern on the minds of parents, teachers, and students, especially with vaccines not available to those under the age of 12 yet. We hear from a high school student who's doing her part to keep her peers informed, and her father, who is with Roseman University's College of Pharmacy. But before we go to break, your Las Vegas Raiders share why they chose to get vaccinated.
I told him it was safe. Look at me. I said I didn't want him to get sick. I said we're all on the same team.
I said it was important to our team and our fans. I said that Las Vegas needs us.
I said it was our best shot at beating this thing. I said enough people have died. I said to do it for our community.
Welcome back to this News 3 Town Hall, Operation Vaccination. Clark County schools are back in session, and with more students and staff in close quarters, the more COVID cases are likely to rise. Right now, there are nearly 800 COVID cases in the Clark County School District. Most of those are students, nearly 200 from elementary schools, 89 middle schoolers, and 96 are high school students. Our next guests join us from Roseman University and a local high school. We have Dr. Manas Mandal and his daughter Sohini Mandal. She's a senior at Green Valley High School. Thank you both so much for joining us. So let's start with this first question. What do you see are the biggest questions among teens about getting the vaccine?
Back in February, before vaccinations were available to teenagers in large amounts of people, most of the people that were hesitant, they were scared about potential side effects since they were just starting to vaccinate large amounts of people. And that was really the main cause of hesitation in those that I surveyed and interviewed. It was a lot of unknown factors that were surrounding vaccination, and a lot of teens didn't learn about the background of the vaccine, what it was made of, and how thoroughly it was tested. So there was a lot of hesitancy surrounding just what it could possibly do to a person other than protect them from COVID. I think that another main source of hesitancy was the idea that the speed of the vaccine's development made it kind of untrustworthy, which simply isn't true. But a lot of teenagers weren't necessarily taught the background behind what it takes to get medication or any vaccine approved by the FDA. So that was a point of a lot of hesitancy.
On top of that, I would like to add that the data is very clear. If one gets vaccinated, we have 3 approved vaccines against COVID-19, 2 mRNA vaccines, Pfizer and Moderna, and Johnson & Johnson adenoviral vector vaccine. All 3 are very good, safe, and effective against protecting 1, serious diseases, illnesses, hospitalization, above 99% level. Regarding the Delta variant, story is slightly different, but still, who are infected with Delta variant and ending up in hospital, and some of them unfortunately dying, none of them are vaccinated. Therefore, it is very, very important to get those vaccines in the teens, in adult population, because we have to remember, this Pfizer and Moderna vaccine have been approved, particularly Pfizer vaccine, up to 12 years of age. But in many households, there are children who are below that age level. They are also going back to school. So we have to come up with a protective barrier, protection of vaccine protection around them so that they remain safe. Idea is that if I am getting vaccinated, and if I am vaccinated after 2 weeks of immunization, I am reasonably well protected against serious infection. And if I do not get infected, I cannot transmit the infection. Therefore, it's our moral duty who can get the vaccines, they should get immunized, at least at this point. On top of that, if one has any hesitation so far about the safety of these vaccines, a great news came out today. FDA approved Pfizer's full authorization of COVID-19 vaccine. What does it mean? It means that it is safe to be used like any other pediatric immunization, and now doctors can prescribe and recommend COVID-19 vaccines up to children of 12 years of age.
Yeah, really so much has changed within just the last week or so alone. And obviously the big news coming today from the FDA. Dr. Mandal and Sohini, thank you so much for joining us and sharing your insight and your expertise. You know, News 3 wants to hear from you at home. We asked you on social media, once they are available, will you get a COVID-19 booster shot? More than 300 people already sharing their thoughts. You can weigh in as well on the News 3 LV Twitter page. And remember, the conversation does not end here. If you have more questions about the COVID-19 vaccines, you can ask us on our News 3 Facebook page. Our COVID coverage continues morning, noon, and night. Still ahead on this News 3 Town Hall, Operation Vaccination. Are vaccine mandates legal in Nevada? Can public places require proof of vaccination? Those questions answered by a local legal expert. But first, Pope Francis adds his voice to a campaign to overcome vaccine skepticism.
Gracias a Dios y al trabajo de muchos, hoy tenemos vacunas para protegernos del COVID-19. Ellas traen esperanza para acabar la pandemia, pero solo si están disponibles para todos y si colaboramos unos con otros. Vacunarse con vacunas autorizadas por las autoridades competentes es un acto de amor, y ayudar a que la mayoría de la gente lo haga es un acto de amor.
Welcome back. Our final guest this evening is Colleen McCarty, an attorney with Fox Rothschild, to answer your legal questions about the COVID vaccine. Colleen, thank you so much for joining us here. So many questions out there. So let's start off with this. So can employers mandate the COVID vaccine, which now, as far as Pfizer is concerned, has that full FDA approval?
Yes, but they could mandate it before the full approval. The full approval really allows, I think, companies now to have a greater comfort level. The experimental language is no longer attached to the vaccine, so when they're talking about a vaccine mandate, they now know that they have all the additional safeguards that go with that FDA approval.
Let's talk about, again, that emergency use authorization hold and that legal standing. You were saying that they didn't necessarily even need to have that full authorization. But now that that's been removed, do you see more companies saying, let's go include this in our policy then?
Sure. The full FDA approval is a total game changer. It's going to create that additional comfort level for employers who have been waiting for that experimental language to go away. I think in the coming weeks, we are going to see vaccine mandates at employers across the board in many different places.
One of those places where we just saw a new mandate is the Nevada System of Higher Education, basically saying by the spring semester, all of their students, that they will need to be vaccinated against COVID-19. Do you see other Nevada schools also following suit?
Absolutely. Across the country, there are 730 some colleges who have already taken this step, and the lawsuits that have been engaged against requiring a vaccine mandate in higher education were all based on that experimental language. And now that that's gone, I think we'll see more institutes of higher education moving that direction.
Religious exemptions, that's been brought up, especially with today, the Catholic Diocese of Las Vegas saying that they won't issue any religious exemptions for the very small number of requests that they received. Can you touch on legal exemptions? What are they, and who would be eligible for them?
So when it comes to the vaccine mandate, essentially there are two. There's the religious exemption, or there's also a disability or a medical objection. And essentially how it works is you go to your employer and you tell your employer, I have a religious objection based on a sincere religious belief. Or if you can discuss medical proof and medical conditions that might prevent you from being vaccinated, at which point your employer and you would work together to figure out whether or not an accommodation can be made to allow you to continue to work there.
We have another minute left in this. So what has the conversation been like with businesses and employees? So many uncertainties out there. A lot of people are probably likely coming to you with questions. What are you hearing?
You know, big picture, employers are required to provide a safe workplace for their employees. So the questions we get constantly are, what is the best way to do that? And what we know is that the CDC has said that the leading public health prevention strategy right now is vaccination. So there's been so much discussion about, should I require the vaccination? And of course, politics plays into it as well. My clients who do not believe that the vaccine, you should be infringing on people's rights in that way, they're not going to require it. Others are absolutely requiring it because they think it is the safest way for them to protect their employees.
And that's where we're going to have to end Operation Vaccination here. Colleen, thank you so much for sharing your time and your expertise. You know, for everybody at home, remember the conversation does not stop with this broadcast. If you do have more questions about the COVID-19 vaccine, we hope you connect with us on our News 3 Facebook page. Our COVID coverage continues morning, noon, and night. Once again, that wraps it up for Operation Vaccination. This is Your Voice, Your Future, a News 3 Town Hall. For more information about where to get a vaccine, you can find all of that on news3lv.com. For all of us here at News 3, good night and take care.